I am the father of 3 little girls that are 10, 8, and 5, and one of the things I miss most about being here and not being in Colorado is being able to read to them at night and or with them. Over the years, we've moved from one thing to another. Harry Potter is now being read there. But I had a story from Colorado this morning that I couldn't believe that reminded me so much of Goldilocks and the 3 Bears that that's what I wanted to talk about today. In Colorado, several weeks ago, we had a young boy named Alex Lang who was 4 months old and he's 17 pounds. He was denied insurance because of his, quote, pre-existing condition, which in his case was obesity. Bernie and Kelly Lang, his parents, tried to get insurance when they were told by an insurance broker that their baby was, quote, too fat to be covered. As his father said, quote, "I could understand if we could control what he's eating, but he's 4 months old. He's breastfeeding. We can't put him on the Atkins diet or on a treadmill." So that was one story of a child that was too fat to be covered. Today, we have the story of Aislinn Bate. Oh, by the way, in that case, and I want the record to reflect this, the insurance company did the right thing, which was to say we made a mistake and we need to cover this young man. Today comes the story of Aislinn Bate, who is 2 years old, 22 pounds, denied insurance because of her pre-existing condition, Mr. President, which is that she is underweight. Rob and Rachel, her family, tried to get insurance when they received a letter saying, "We are unable to provide coverage for Aislinn because her height and weight do not meet our company's standards." Her pediatrician wrote a letter in support of the family's request to appeal the insurance company's decision, but the company stuck by its decision. The Bates family has said that it costs as much to cover Aislinn under COBRA as it costs to cover the remaining 3 family members. So in Colorado, we've got children that are too big to be insured. We have children that are too little to be insured. And the reason this reminded me of Goldilocks was that it looks like you have to be just right to get insurance, even if you're an infant. And we can do better than that as a country, and we are proposing to do better than that as a country. One of the most important parts of this insurance reform, Mr. President, is to get rid of denials of coverage based on pre-existing conditions. I've talked to many people that work for insurance companies who are tired of having to deny claims for this or for that or relying on the fine print when they know the right thing to do is to provide coverage. I'm tired of living in a country where 62% of bankruptcies are health care related and 78% of those health care related bankruptcies are happening to people that have insurance, working families that have insurance. I'm tired of the fact that we have a public hospital in Denver that 2 or 3 years ago spent $180 million of taxpayer money on uncompensated care for people employed by small businesses. So what we're talking about here is, at the end of the day, I think, is trying to create some stability for our working families, trying to create some stability and some fairness for our small businesses who, after all, are paying 18% more to cover their employees just because they're small. Politics has gotten in the way of our reform of our health care system for more than 20 years. It's been longer than that. In the last 10 years alone, the cost of health insurance premiums have gone up 97% in my state, while median family income has declined by $800 over the same period. This is unsustainable for our working families. It's unsustainable for us as an economy, for us to spend more than twice, Mr. President, what any other industrialized country in the world is spending on health care. We can't hope to compete in this global economy when we're devoting more than twice what anyone else is spending on health care. We can do better than this. The common sense reforms that are in front of us, that I'm sure are going to be improved in the coming weeks, are a big step forward for working families and small businesses. It's going to be a big step forward for these young children in Denver, Colorado, and in the rest of our state who can't be denied coverage because they're not just right, because they're too big or they're too small or there's one other issue that nobody anticipated. Our families need help. They need stability in order to get ahead, and that's why I support this health care reform effort.